Ever wondered why calcium is crucial for our body? Well, let's delve into the fascinating world of this essential mineral. Calcium plays a pivotal role in maintaining the health of our bones and teeth. It's the stuff that gives them their strength and structure. But that's not all. It's also a superstar when it comes to the smooth functioning of our muscles. From the beating of our hearts to the flexing of our arms, calcium is the unseen conductor orchestrating these movements. And let's not forget its role in nerve signaling. Calcium helps transmit messages between the nerve cells and other parts of the body, ensuring our systems work in harmony. So you see, calcium is quite the multitasker, playing several vital roles in our body. So now that we know why we need calcium, what happens if we have too much or too little of it? Imagine having too much calcium in your bloodstream. That's hypercalcemia for you. Now let's dive into the details of this condition. Hypercalcemia is a state where there is an excessive amount of calcium in your blood. In the grand scheme of things, calcium is a vital mineral that your body needs. It's crucial for bone health, nerve transmission, and muscle contraction. But as with most things in life, too much of a good thing can be harmful. So, what can cause this calcium overload? One common cause is hyperparathyroidism, a condition where your parathyroid glands, tiny glands in your neck, produce too much parathyroid hormone. This hormone helps regulate calcium levels in your body, and when there's too much of it, your blood calcium levels can spike. Certain types of cancer can also lead to hypercalcemia. Some cancers can produce substances that mimic the action of parathyroid hormone, leading to high blood calcium levels. Now, let's talk about symptoms. Hypercalcemia can present a range of symptoms, and these can often be subtle and non-specific. You might experience fatigue, a feeling of being unwell, or nausea. You could also find yourself feeling more thirsty than usual and making frequent trips to the bathroom. But what happens when hypercalcemia affects your body? Well, when left unchecked, it can lead to complications like kidney stones, a condition where hard deposits made of minerals and salts form in your kidneys. Osteoporosis, a condition that weakens bones and makes them fragile, is another potential complication, as high blood calcium levels can lead to loss of bone mass. So you see, hypercalcemia is not just about having too much calcium. It's a complex condition that can impact your body in multiple ways and cause a range of symptoms. It's important to know the signs and seek help if you suspect you might have it. Hypercalcemia can indeed be a serious condition if left untreated, but what if the opposite happens? Now, picture having too little calcium in your blood. That's what we call hypercalcemia. Let's dive deeper into the concept of hypercalcemia. It's a condition characterized by calcium levels in your blood being lower than normal. Remember, the normal range is between 8.5 and 10.2 milligrams per deciliter. So, when the calcium level drops below 8.5 milligrams per deciliter, that's when hypocalcemia sets in. How does this happen? The most common causes include inadequate intake of calcium in your diet, problems with how your body absorbs calcium, and conditions that decrease the amount of calcium in your body, like hyperparathyroidism. This is when your parathyroid glands, tiny glands in your neck, don't produce enough of the parathyroid hormone, which plays a key role in regulating your body's calcium levels. Now, what are the symptoms? They can range from barely noticeable to severe. Early signs may include muscle cramps and numbness in your hands, feet, or around your mouth. As the condition progresses, you might experience confusion, depression, or hallucinations. In severe cases, hypocalcemia can even lead to seizures. And what about the effects on the body? Long-term hypocalcemia can lead to dry skin and brittle nails. It can also contribute to osteoporosis, a condition that weakens bones and makes them more likely to break. In the cardiovascular system, hypocalcemia can cause abnormal heart rhythms and even cardiac arrest in severe cases. So you see, hypocalcemia isn't something to be taken lightly. It's crucial to maintain a balanced diet, rich in calcium, and to ensure your body is absorbing and regulating calcium properly. If you're experiencing any of the symptoms we've discussed, it's important to consult with a healthcare professional. They can help you figure out what's going on and guide you towards the best course of action. Just like hypocalcemia can also lead to serious health problems if not addressed. So, hypercalcemia and hypocalcemia, two sides of the same coin, aren't they? Indeed they are. Hypercalcemia and hypocalcemia, while seemingly opposite, do share a common thread: the critical balance of calcium in our bodies. But let's dive in to understand their unique characteristics and effects. Hypercalcemia, as we've learned, is the condition of having too much calcium in the blood. On the flip side, hypocalcemia is when there isn't enough. Both these conditions disrupt the normal functioning of our bodies, though in different ways. When we talk about causes, hypercalcemia is often linked to overactive parathyroid glands, certain types of cancer, prolonged immobilization, or excessive intake of calcium or vitamin D. Hypercalcemia, on the other hand, is usually caused by low levels of parathyroid hormone, vitamin D deficiency, kidney disorders, or certain medications. Now let's consider symptoms. Hypercalcemia can cause excessive thirst and frequent urination, stomach upset, bone pain, and confusion. In contrast, hypocalcemia might result in muscle cramps, numbness, depression, and even hallucinations. So, while both conditions affect your physical and mental well-being, the specific symptoms are quite distinct. In terms of effects on the body, both conditions can be severe. Hypercalcemia can lead to kidney stones, abnormal heart rhythm, and osteoporosis. Hypercalcemia, if not treated, can cause seizures, heart failure, and in extreme cases, be fatal. While hypercalcemia and hypocalcemia may seem like mirror images, their causes, symptoms, and effects on the body are uniquely their own. But they both underscore the same crucial point: maintaining the right balance of calcium in our bodies is vital for our health. To sum it up, hypercalcemia and hypocalcemia are indeed two sides of the same coin, but they are not identical. Each side has its own set of challenges and potential health risks, and each requires a different approach to manage and treat effectively. So, we can see that both conditions, though opposite, can be equally harmful. Now that we understand these conditions, let's explore how they can be treated. Hypercalcemia and hypocalcemia, while being opposites in terms of calcium levels, can both be managed effectively. The treatment approach will largely depend on the severity of the condition and the underlying cause. Let's start with hypercalcemia, where there is too much calcium in the blood. Mild cases may not require immediate treatment, but are closely monitored. The focus here is on maintaining hydration, encouraging a low-calcium diet, and promoting mobility to prevent bone loss. In more severe cases, medications might be necessary. Bisphosphonates, for instance, can help slow down the release of calcium from the bones. Calcitonin, a hormone, can also be used to regulate calcium levels. In some exceptional situations, dialysis might be considered to quickly reduce calcium levels, especially when other treatments are ineffective or contraindicated. Now let's switch gears to hypocalcemia, where there is too little calcium in the blood. Here the treatment involves supplementing calcium and vitamin D. This can be done through oral supplements or, in more severe cases, intravenous administration. It's also important to address the underlying cause, whether it's a dietary deficiency, a medication side effect, or a condition like hypoparathyroidism. If hypercalcemia is caused by a parathyroid disorder, surgery may be considered. This could involve removing the diseased parathyroid glands or transplanting healthy ones. Of course, every treatment has potential risks and benefits, and the decision should be made in consultation with a healthcare provider. Whether you're dealing with hypercalcemia or hypocalcemia, remember that treatment is just one piece of the puzzle. Lifestyle changes, including a balanced diet and regular exercise, can also play a crucial role in managing these conditions. In both cases, it's essential to monitor calcium levels regularly and to adjust treatments as necessary. This helps ensure that the calcium levels remain within the target range, reducing the risk of complications. Remember, early detection and treatment can prevent serious complications. So keep an eye on your health, and don't hesitate to seek medical help if you suspect something is amiss. Your body will thank you for it. Let's wrap up what we've learned today. Calcium plays an essential role in our bodies, and maintaining the right balance is critical. Hypercalcemia, characterized by high calcium levels, can lead to excessive thirst, kidney stones, and even changes in brain function. On the flip side, hypocalcemia, with low calcium levels, can result in numbness, muscle cramps, and in severe cases, heart failure. Both conditions can be caused by a variety of factors, including certain medications, kidney disorders, and imbalances in other hormones. The symptoms often mirror each other, affecting all systems of the body, but with a keen eye and awareness, they can be identified early. Treatments vary, but they generally aim to restore the calcium balance, often through dietary changes, medication, or treating the underlying cause. So remember, maintaining the right balance of calcium is crucial for your health. Stay informed, stay healthy.